So, given that that was the plan, please do keep your video on during such interactive sessions, the interactive session at the end, and do unmute when you are responding during the interactive session so that we can hear you and we can see you. And if in the course of this talk and during the Q&A session, if you have questions, do feel free to key them into the chat box so everybody can see them and so that we can address them one by one. All right. So without further ado, today's program really looks at what ChildKind stands for and what a ChildKind certification would mean for your hospital. We'll hear about how it's not just about the doctors. We'll hear about the 5 principles of ChildKind and the elements that you will need in your hospital in order for to have a successful certification. We'll hear from Dr. Serene Lim about the true story of the struggles of getting accredited in the COVID period. And finally, we'll wrap up with a very kind of the intention is for it to be a kind of a cozy, ask me anything session. So if everybody would turn their videos on at that point, we could have and grab your cup of tea or cup of coffee. It would be great so that we could answer any questions. And if you have any barriers to good pain management in your country that you think you'd like some help solutioning for from this community, do feel free to bring it up there and we will talk about it together. So I'd like to introduce our first 2 speakers, one after another. So Dr. Alan Finley. Dr. Alan Finley is highly esteemed. He's a pediatric anesthesiologist who has advocated for pain for the past 30 or so years. He's a professor of anesthesia, pain management, and perioperative medicine at Dalhousie University. He's cross-appointed as professor of psychology and neuroscience, and he also holds the inaugural Dr. Stewart Winning Chair in pediatric pain management at IWK Health in Halifax. He's also the director of the Center for Pediatric Pain Research, and he is very, very well published and has lectured widely on all 6 continents. Dr. Alan Finley is actually also the honorary advisor to our Pediatric Pain Special Interest Group, which is testimony to his commitment to his advocacy for pain management in children around the world. It is 6:30 in the morning for him, so thank you very much, Dr. Finley, for being here with us. Another person who's also awake very, very early in the morning at 5:30, I believe, in the morning, Dr. Bonnie Stevens. So Dr. Bonnie Stevens is the ChildKind Certification Committee Chairwoman. She's a professor at the Lawrence S. Bloomberg Faculty of Nursing and Faculties of Medicine and Dentistry at the University of Toronto. Dr. Bonnie Stevens wears many, many hats. Her research focuses on assessment and management of pain in hospitalized preterm newborn infants and the effectiveness of knowledge translation strategies for changing clinical outcomes. Thank you very much, Bonnie, for joining us this morning. We have a 3rd speaker, that's Dr. Serene Lim, who's going to share with us the Singapore story. She's a senior consultant at KK Women's and Children's Hospital. She founded the Children's Hospital Children's Pain Service there, and during her 1995 fellowship at Boston Children's, developed a special interest in pain, for which she credits Dr. Nabil Sethna and Dr. Charles Birdie. And she has very diverse interests, but currently her special interests include complex oncological pain and pseudoanalgesia and weaning in critically ill neonates and children. And her passion for high standards, very stringent standards in pain management, made her our hospital's principal liaison for ChildKind certification. So there's no one better to share the story. So without further ado, I'm going to hand the floor over to Dr. Alan Finley and Dr. Bonnie Stevens. Alan, take it away, please.
Okay. I am going to hopefully share my screen and start the slideshow. So good day, everybody. I wish I was with some of you in Istanbul and with actually anywhere that any of you are watching from. It's our pleasure to give a brief overview of ChildKind, what it means, and how to be part of it. This will be fairly short. We're looking forward to Serene's description of how the process went in Singapore, and even more looking forward to your questions and discussions and thoughts as we go forward. So everybody here, I think, knows that untreated or undertreated pain leads to unnecessary suffering, not only for the child, but also for the whole family. It has short and long-term consequences, including actual altered neuroanatomy and neurophysiology, fears, psychological effects, longer recovery times from surgery, decreased quality of life, and also, in fact, a higher risk of persistent or chronic pain in childhood and in adulthood. The other thing we also know is that if we could only apply the knowledge we already have, the overall burden of pain that children experience would be much reduced. Clearly, more research is always needed and always important, but we already know a lot of what we need to do to make things better for children and families when they come through our care in the hospital. There was increasing recognition in the literature that changing behavior in healthcare, in pain care, doesn't just need education for clinical staff. It needs institutional change that allows actual systemic different changes in how hospitals operate. There have been research in other areas and in the adult world that encourage this commitment to institutional level change. The Baby Friendly initiative from WHO and UNICEF was highly successful. That was a program to promote breastfeeding by instituting a number of low-cost, easy interventions, such as not using commercial formula unless it was absolutely necessary, putting the baby to the breast within 30 minutes of birth, educating families and caregivers to make breastfeeding a preferred option. And this has been successful, and baby-friendly certified hospitals exist all over the world, thousands of hospitals. This was really one of the inspirations for Neil Schechter to bring the idea of ChildKind to the IASP Special Interest Group on Pain in Childhood as a project that the SIG could endorse and encourage. Thanks to his inspiration, we had an organizing meeting at the Rockefeller Center in Bellagio, Italy in 2008. This was a great group. We had 20 participants from 14 different countries and from WHO, and in fact, also representing 8 different professional disciplines. That was where the original development of the ChildKind principles occurred, and the idea of how we would develop a certification process. The goal of ChildKind International is to recognize an institutional commitment and to pediatric pain relief and excellence in that process. It's to educate and advocate about the negative effects of inadequately treating pain, and to develop an open exchange of sustained knowledge and best practices through the uniform application of evidence-informed pain prevention and treatment strategies across disciplines. And I will say our focus is children always. If it happens to spill over into adult care, that's not so bad. ChildKind recognizes healthcare facilities that have standardized institution-wide collaborative approaches to the treatment of children's pain and policies to support those. And then those hospitals are certified as ChildKind certified hospitals. We also have an open access resource library of policies and procedures, which are contributed to by certified hospitals, thus making it easier for those institutions that are trying to start up a program to use resources that have been developed elsewhere without having to start from scratch. We also try and provide guidance to institutions that are working to improve the pain management they provide. And in fact, following the principles and developing the program to meet certification is really the success in itself, whether or not it's completed to full certification. The process is the win. So there are 5 principles that have been developed. First is an institution-wide commitment to pain prevention and treatment, as evidenced by policies and public statements by the hospital that everybody can be aware of. An education program for staff and families, and not just clinical staff, really, is an essential criterion. Developmentally appropriate pain assessment protocols. So regular pain assessment, assessment after treatment, treatment protocols that are appropriate to the institution. For example, if you run a pediatric oncology program, you probably need a protocol for management of the pain from chemotherapy-induced mucositis. If you're a smaller local center and you don't have that type of treatment program, you probably don't need a mucositis protocol. But every hospital is going to need protocols for management of procedure and needle pain because every hospital does that. And finally, of course, you need quality improvement and self-monitoring approaches to make sure that you're continuing to follow the first 4 principles. So now I'm going to hand over to Bonnie to continue with the rest of this section of the program. And I will hopefully, I don't know if I can, I will try to mute myself and look forward to the rest of the program.
Thank you very much, Alan. I would just like to begin by thanking the organizers for inviting me to this program. It's always such an opportunity to work with my colleagues at ChildKind, but also with the sites that have been certified. And that definitely includes KKH in Singapore. I'm going to talk about the certification process today, but the slant that I would really like to take is that this is a process that takes a lot of energy and initiative, and it really works well when it's an interdisciplinary team that takes this on. As Alan said, back at the original meeting in Bellagio, there were 8 different professions that were represented at that meeting. And most often when sites are certified, we see evidence of many different professions that lead and take part in the certification process. So I think the title for this session was, it's not just about doctors, but I really wanted to focus on the interdisciplinary team and the role that they play. Next slide, please. Are you able to do the next slide, Alan? I think you're muted. Oh, there we go. Thank you. So the child certification process, as we just heard, provides institutional recognition for collaborative efforts and evidence-based approaches. And it really falls into three large buckets. So first of all, there's the pre-application stage, then the application itself, and then the site visit where we actually are able to see and experience the ChildKind application. So in the pre-application, this is where sites put forth an initial expression of interest. Often they have questions about eligibility. And during this pre-application process, we encourage the sites to do a gap analysis. So this really allows them and us to see what things are in place. So maybe what pain assessment protocols, what pain management protocols, what quality improvement initiatives, and also to have an initial assessment interview with the ChildKind Certification Committee, using the gap analysis as a basis for that. At the end of that interview, usually we can tell a site one of three things. First, that it's great that you're interested and you have a lot of things to work on and develop. Or maybe the site has quite a few things in place, but there are some gaps. So that might be a second conclusion, or perhaps they have everything ready. It just means pulling it together. So all of this happens in the pre-application phase, and a member, or sometimes a couple of members, are assigned to be the key contact with the site. And those contacts will be in place over months or sometimes even years. In the application stage, once we've decided mutually that the site is ready to move forward with the application, then we ask them to actually complete the portfolio application. And this is structured, it's online, and we ask that it all be submitted, and then it is reviewed by the ChildKind Certification Committee. And we then decide at the end of that meeting if the site is ready to proceed to a site visit. If they are ready to proceed, we then organize the site visit at a mutually agreeable date. And usually it's a one-day site visit where the site visitors would come usually the day before, they get themselves organized, and then we have a full day of a site visit the following day. The results of the site visit are then taken back to the certification committee, and we link the site visit and the application together and come up with our decision for certification. And then all of this is based on the 5 criteria that Alan described to you, and we usually make a report based on those criteria. Next slide, please. So we've learned over time that there are benefits for the institution, both during the certification process and following certification. And in 2020, a survey was conducted of the ChildKind certified hospitals. And we really asked them to describe the benefits to participating in the certification process. And what we heard was there were a lot of benefits at the site. For example, this whole activity promoted interaction and collaboration between disciplines and departments on best practices. It helped provide the organization and structure to multiple pain initiatives. The gap analysis really provided an in-depth look to both recognize established areas of innovation and excellence, and also areas that needed attention or needed growth. It was an opportunity to look at programming in a more comprehensive way. And it also created standardization, updating of policies, procedures, and guidelines. Next slide, please. Following certification, the sites that were certified talked about the recognition that they received for pediatric pain within the hospital, both within the hospital and I should say external to the hospital as well. There was institutional support for quality initiatives. And again, linking these quality initiatives to the ongoing clinical care and research was something that was really important. It helps to engage the culture of the organization into considering pain across disciplines. So the culture of the organization, the way we do things around here, this really allowed, ChildKind certification allowed that to percolate up through. It provided opportunities to leverage the desirability of a ChildKind certified hospital when multiple choices of hospitals exist in a region. Families appreciated the emphasis on pain management and the visibility of that in the hospital. Healthcare professionals from multiple disciplines sought out the expertise of the pediatric pain team, and there was more consistent expectations. And there was that whole legitimized and validation for the need for excellence in pediatric pain care. Next slide, please. So ChildKind really made a difference. It really made an impact. And these are just some of the impacts. So the Award of Excellence that was recognized by peers in terms of excellence and leadership in the prevention and treatment of pediatric pain within the institution. There was also opportunities for benchmarking and quality improvement. So for example, the assessment of initiatives within the institution and the identification of gaps in pain care. Workplace morale improved. There was improved child and family experience in both the prevention and treatment of pain, and improved morale of healthcare professionals, resulting in reduction of staff turnover. As Alan mentioned, there's the resource library, and this is one of the most sought after repositories of new knowledge. We constantly get requests for best practices, policies, and protocols. So all of the certified hospitals contribute their policies and procedures, and these become available to all members of certified hospitals. And then there's the Innovation Network. So this is really creating the community of practice that supports mentorship and knowledge sharing on the best practices in pediatric pain. Next slide, please. So to summarize the certification process, and some of what Alan has said is that we know that despite new research, attention to pain is not uniform and is often inadequate. We really need a way to translate what we learn from research into practice, and ChildKind is an organizational knowledge translation strategy that was established and is used to foster behavioral change through institutional commitment. We do this through consideration of the 5 ChildKind principles. And in addition to promoting and recognizing excellence, ChildKind hopes to create a community of practice where creativity can be fostered and shared across disciplines. So it is not just about doctors, it's about multiple disciplines creating this positive initiative. And I'll just leave you with an update. We now have 14 ChildKind certified hospitals, and 2 are ready for site visits that we are in the process of organizing, and another 10 are actively involved in the pipeline for certification. I believe that's the last slide. Thank you.
Thank you very much, Bonnie, and thank you, Ellen, for that very excellent rundown on what is involved in a certification process. So just a blurb here, an advertisement for the International Symposium of Pediatric Pain. That's going to happen in 2023 in Halifax, Canada, and it is the pediatric pain symposium that you want to attend. In general, you'll find a lot of pain symposiums or pain meetings will have a huge adult component and a small pediatric component. This symposium is dedicated to pediatric pain. So if that's your thing, save the date. All right, excellent. Now we're going to go, last but not least, definitely, Serene's going to share with everyone the long
the long and winding road.
I was going to say arduous journey, but it was a very exciting journey. There were a lot of hiccups. We are placed, so Singapore is placed slightly differently, and I do know that everybody will have their own barriers to getting certified. But let's hear Serene's story about what we did in Singapore, and then after that we can kind of open it up to the floor and we can all have a nice chit chat and a cup of tea with all the videos on. All right, Serene, the floor is yours.
Okay, I hope this works because it worked the first time. And can you see my slides? Can you see my slides?
Yes.
Cool. Okay, so hello, fellow ASPA members, and if there are any pain sick groups here. KK is fresh from ChildKind certification in March this year, and it was a really long and arduous journey, but we were like fired up because it was a very enriching and rewarding one. So I'd like to encourage more people in Asia, if they're interested, to consider ChildKind certification. This is a story of our journey. You saw the process, right? Yeah, so we actually started looking for ChildKind certification in 2018, and we presented it to the medical board when we successfully passed the first hurdle, which is the conference call probe, seeing whether we have things set up in our hospital to which follow the 5 ChildKind principles. Then what happened was that we actually took a little while getting the budget sorted, because we would be the first outside the United States and Canada to have a site to have this, and we were not very sure how to go about budgeting it. And then COVID struck 3 times, so it became a little bit like oh, we're going to do this in 2020, end of 2020, and then COVID hit, and then we went into lockdown. So the whole journey took about 3.5 years. And I think there's a critical time because beyond this, we were getting quite frustrated. It was like between scheduling a virtual site visit, because that was the only way that we could ever get certified, versus an actual site visit, which was actually what the auditors preferred. So the long and short of it is we finally got certified in spite of having an Omicron surge during certification. So the nurses were very stressed, and I have to thank them for actually stepping up to the mark. And also the children's emergency was really overloaded. Okay. And I would like to tell you that the part of our journey was because I think what made it easier for us is that pediatric pain was always very passionate about pain care in the hospital. And we can see that from when we started at the new KK hospital in 1997, we already had a children's pain service, and gradually grew to have a pain clinic, then a pain nurse that we fought for. And then came JCI, which made the rest of the hospital a little bit more interested in pain and pain standards. And during the JCI inspection, there was a little bit of a gap in assessment, especially throughout the hospital. It was not uniform. Subsequently, our department came up with pain reports to report gaps, both in workflows, medication errors, anything that could highlight how our pain work was being obstructed during the pain rounds and on the floor. And the thing that turned it around was actually the pain committee. So we got actually certified in 2022 this year, but the pain committee was already in effect in 2014. And why is that so? That's because truly when we come to these conferences and we hear speakers get inspired, they're good ideas, they spark something in us, and we come back to our country and then we try to apply it to the work. So we knew about the 5 ChildKind principles and the exciting work of how ChildKind began, because I've known Alan from the 2nd International Forum for Pediatric Pain, and Dr. Dilip Power also came to Singapore and did a sabbatical with us at KK Hospital. So they were also advocating having a top-down people invested in pediatric pain from management level and not just people working on the ground. And this was further emphasized in 2010 Acapulco, the ISPP, when we heard Gary Walker talk about how taking a CEO to a burns ward, watching a kid screaming in pain, sort of like got the message that something had to be done to improve pediatric pain. So all these things actually made a difference in how we worked and how we tried to organize things to have an effect. All right. So the pain committee is a multidisciplinary committee that has a representation from both nurses and non-medical, for example, the Office of Patient Experience, and it also has surgeons and physicians, children's emergency physicians, etc. And then came the era of quality improvements, where we have HCAPS, the Hospital Consumer Assessment of Healthcare Providers and Systems, which actually charted pain scores in the wards. So potentially you could go through the hospital, HCAP scores, and award for that month the ward with the best or the lowest pain scores for the based on patients' assessments. Also the Ouchless Initiative, where we actually got Amitop applied before needles stick and before taking blood and setting drips. The Singapore Healthcare Improvement Network, or SHINE, focused on opioid safety, did a lot to improve the safety, especially of morphine infusions and the administration of opioids. And then there was more focus on pain education. And because COVID hit, that became pretty much the norm, where we actually had a lot of online education stuff. And along the line, because we tend to get called for difficult IV access after the child has been poked like a gazillion times in the middle of the night on our calls, then our department actually initiated a DIVA protocol, and we sort of got that rolled out, both with the aegis of the pain committee, so that there is a limit to the number of times the kid is poked before they ask for somebody who's a little bit more specialized. And then, of course, Angela, our president of the ASPA Pediatric Pain SIG, got that going. So that was exciting. So you can see we have been chipping away at pain work year by year, culminating with the 2022 ChildKind certification. There's also the procedural sedation committee that actually has like ketamine and midazolam, fentanyl, the cytoanalergic drugs in doses with the proper documentation and monitoring for painful procedures in the hospital. So you can actually see that learning from our mentors and experts such as Barney and Alan and Gary Walco, it's been a great experience. Okay, so when we started, we had to convince our medical board that ChildKind was a good idea. So our slogan is patients at the heart of all we do. And truly, pain does matter to our patients. If they have a really bad pain experience, it traumatizes them. They hate going to hospitals. They hate nurses. If they have a good experience, then say, oh, I like this hospital, you know, I get to play, it doesn't hurt. So this actually impacts both on the psychology and the mood of nurses, as well as it's actually for the hospital's reputation. So because if effectively alleviating a patient's pain is very rewarding, and nurses especially, they find doing something and doing something right is important. So we needed this first medical board presentation to get institutional approval and to tabulate the fiscal budget. And we did highlight that the ChildKind values are very parallel to what KKH as a hospital values, which is excellent care and compassionate care and collaboration, of which compassion is the buzzword this day, because with compassion, it elevates medical care beyond something cold and clinical into something better. Okay, we've heard about the benefits of pain care, so I won't dwell on this. So let's go on to other things. So a lot of people have not heard of ChildKind in our country. I mean, only when we come to the ISP, ISPP, there's always like a ChildKind network. And that's how I got interested. But if come to Singapore, it's like, oh, what's ChildKind and stuff like that. So we try to sort of like, well, it's not advertising, but it's like we had to tell them ChildKind is endorsed by the following organizations who are the big organizations regarding pain. For example, ASPA, Canadian Pain Society, and the American Pain Society, and a lot of other weighty organizations. Because you know, people always like references, and then people also like free knowledge, freebies and stuff like that. So there's excellent educational material, and as well as resource for those who are lost at sea to manage pediatric pain. Another question that I got a lot was, but we have JCI and JCI has pain. So why do we need, ChildKind? Is it the same? So it's not the same, because JCI is an accreditation and ChildKind is a certification, which Bonnie pointed out to me during when we were actually in the process of getting certified. Certification is a one-time thing, and basically because they determined that the hospital has evidence of the 5 ChildKind principles. I think it's pretty much like teaching, the whole hospital how to fish, rather than going through, you have to do this, you have to do that. And it's pretty much, I think, correct me if I'm wrong, Alan and Bonnie, is that once you have the 5 principles, it pretty much autopilot self-perpetuates a framework and foundation for it to continue. The other thing that I like to have an analogy with is, if you're going to have your son be a professional violinist, you certainly won't send him to a French horn player, or even the same string instrument, the cellist, because the repertoire is different, and also the techniques are different. And definitely the best critic, teacher, advisor, mentor, somebody who has in-depth knowledge, acknowledged expertise and experience. So without ado, ta-da, our auditors. So what more can you say? So with us being a certified hospital on 23rd of March, I can tell you that the thrill and jubilation hasn't really waned a lot. So when I meet people who have been on the hot seat and who are, like nurses and all that, they have this smile, and it's kind of a lighter footstep, all right? And being on the same lists with Boston Children's and Hospital for Sick Kids Toronto has been such a thrill for me, because those are the hospitals I wanted to apply for fellowship when I was going for my HMDP, and I was fortunate enough to go to Boston Children's, and these hospitals have been ranked #1 in a row. So it's just such a thrill for us, and because it was newsworthy cause for celebration, being the first. We were featured in the media, but so we realized that in the United States, the other hospitals that were certified after us were equally chuffed, and they were also celebrating. So it is a celebration to be a ChildKind hospital, because it's good for the kids, it's a good purpose, and it's just a nice feeling to be part of the ChildKind family. As Neil Schechter, who's the CEO of the ChildKind board, said, it was just like a nice shot in the arm, and it's not a COVID shot, but a shot of energy and just something good. Okay, so you just need to have, after the green light, get into the nitty-gritty works of the hospital and get a roadmap. And after you have fixed all the itemized stuff in your roadmap, you need to categorize it so that you can present it back to the ChildKind team. And you need a team that's willing to work and do what it takes, which we had, thanks to Angela, Teddy, my boss Yunam, and countless others in our team. If you are dedicated and you keep at it, something pretty is gonna grow. So in KK, we're part of Sing Health Cluster. It's basically a teaching hospital that moved from the old spot in Hampshire, with Children's Services joining it in 1997. So it has 32 pediatric specialties and subspecialties, of which 10 are surgical and 22 are medical. So you can imagine the task of bringing everybody, every different department, which has different attitudes and prioritization of pediatric pain, to the ChildKind table. Oops. Okay, ChildKind will also ask for the statistics, and so, you know, how many admissions and how many specialist clinics, etc., to get an idea of the load and the amount of pediatric patient fronting that you actually do. And the task left to us was to make sure that for all these departments and all these activities, we actually had imbued ChildKind principles in them. The only thing I'm going to add to the principle one is that they really want a sincere, it's not just a letter, it's just a commitment that it's going to be a priority, not just for now, for certification, but for later as well. So we took 3.5 years to get to certification. So after 2 years, we had to write another letter of intent, which is basically to reaffirm that ChildKind we were committed to being a ChildKind hospital. Basically, excellent pain care for children, all ages, all sites, a priority. What we found useful was trying to collect all the data so that everybody could see it and make it visible, accessible, and clear. And this is something that we did, and we created an Infopedia map of all the processes and all the protocols according to the ChildKind principles. I have to thank the tireless efforts of Amos, who single-handedly kind of like programmed this. As it grew bigger and bigger, we realized that this could be a possibility if you have a COVID lockdown. If there was a possibility of having the auditors access this. So you can click on policy and procedures and then click here on prevention or assessment, and it will open up to list what there are. And then in the first principle, it's basically with the application letter is actually the letter of intent and so on and so forth. Okay, so it actually describes your children's pain services as well. It also lists the brochures which you can click. All right, so it is quite hefty. It's 11 pages worth unfilled. So you can imagine when you fill it up, it's going to be quite substantial. What I would advise, because there's potentially a lot of inertia, is to get an A team, people who are actually have high energy and investment and dedication. And you need stakeholders, senior leaders, and dedicated team leads. We also had some cross cover because when we had the COVID lockdown, we had different teams as well. So it's good to have, you can see names in 2 principles. So this was like a backup. And of course, we needed other work group members. So again, the pain committee was instrumental. And then we started with each department listing the most common painful problems and procedures and updating their protocols. Okay, and then the pain link nurses also did their bit to to list the pain assessment, to prep with all these knowledge gaps. And then the other thing that ChildKind is interested in is what goes on during a pain link meeting. It's like, if you have a problem and by the next meeting, have you done anything effective to iron it out? So it's not just about listing. And this is Meredith, who we've exchanged 1,000 emails. And you will need one spokesperson rep so that we don't, the auditors don't get spammed by a lot of questions or the same questions from everybody. And Julia Johnson is the latest addition to ChildKind, a knowledge management specialist. And these are the new additions that you can find on the website. Okay, so certification period is over 2 days with one debrief. It was actually 17 days before we could to design a virtual kind of inspection, and we had to do a ChildKind blast so that the rest of the hospital could get on top of the news. So the budget really depends on whether you have virtual or a site visit. After the application package, it's dialogued with the secretariat as well as Linda, who is actually in charge of finances. So virtual site guide, it's good if you have a little video like to show you through, and then it opens up to the spot where you're actually having a clinical site visit. For us, we also have to have consent, and this is the boardroom. Remember to book it like in advance, otherwise you will not have a space to do virtual interviews. You can see over here, there's one nurse waiting in the wings, and we had excellent tech support. And this is what a site visit is like. There might be some overlap because there are 3 auditors. In a real site visit, they can go to 3 different places. And this is us after 2.5 tiring days. So then what? After this, we have also tried to do a ChildKind roadshow where we actually award those who demonstrate ChildKind qualities. So we had a ChildKind Star Award, ChildKind Champion Award, and just to drum up more, what you call it, awareness. Yes. So we also listened to some of the comments that the auditors said. Unfortunately, though they tried to help us campaign for a more pain nurses, there is a worldwide challenge, and this is our dear Yani, who single-handedly is the mother hen of all the pain link nurses. Okay, and we want to do more work through the pain committee, and Teddy and Yunam will be helming this. So these are some of the things that we are actually doing after ChildKind certification. So we're not sitting on our laurels. And we want to be a stronger ChildKind culture and have a little bit more independence and decentralizations in the department, so that the ChildKind principals are already there and they can do their own thing. Finding out that the children's emergency had a really strong pain work was also very, we felt really good about that. And it's just a richer culture for being ChildKind. So we need to keep the fire going. We need a lot of work, and together we can. So join us, being ChildKind. We hope that you will join the family. Thank you, and teşekkür ederim.
Thank you very much, Serene. Thank you, thank you. That was a lot of information in 44 slides. All right, so it's great to see so many of you here interested in bringing ChildKind to Asia, to your regions. What I'm going to do is we actually have a poll. So I'm going to put up the first poll question. And if all of you could just click on that within the next 30 seconds or so, we'll close the poll after that. And I'd just like you guys to all share like how you would describe the state of pediatric pain assessment, prevention, and treatment in your country. So your own personal perception of it, and we'll use, you know, the answers from this to kind of springboard off into a conversation as to how things could be made better and what you might, appreciate more of. We all know that financial resources and manpower resources are huge problems for us, and that pain, especially pediatric pain, is not really a priority. So we have 12 responses. I think if we could have, the other 16, that would be fantastic. Yeah. So we'll close the poll shortly. No worries. And then I do have one other question for you after that. And then we'll open the floor to the Q&A. If you have any questions, please, by all means, feel free to type them into the Q&A, into the chat box, and we can address them. But I will ask for everyone to turn on your videos so we can kind of have a nice sort of chat. It's very hard to talk to us, a black screen or a name on a screen. So it'd be great and consider it a networking opportunity. Okay, so thank you everybody who's responded to the poll. There are people on the poll who have said, so 6% of respondees have said that it's excellent with a minimal lack. 56% do say good enough but can be improved. And another 38% says needs significant improvement. All right, that's great. And can I just find out? So I'd just like to find out if you're comfortable, maybe you could kind of turn on your videos and maybe for those who said kind of good enough or those who said needs a bit more work, would anybody like to kind of discuss that? Or if you're not comfortable speaking, maybe just put it in the chat and we can talk about what kind of barriers there are in your areas. I do see a very great mix actually of people from all around Asia. We do have a Korean representative. We do have some of our Turkish representatives. I definitely see, people from the Philippines. I see people from Thailand, the Japanese. So it would be great if anybody had something to contribute.
While we're really bad in ChildKind to control the pain of the children, unfortunately, because we don't have enough staff to check the people post-operatively or even the children who had cancer pain. So we cannot really check those children, unfortunately.
Right.
So we have a lot of way to go.
Hi, Alvin, maybe you can just sort of briefly introduce yourself. So Alvin's on the Pediatric Pain Sig Council, but Alvin, I'll let you introduce yourself.
Yeah. Okay. I'm a general anesthesiologist actually, but I'm really interested in pediatric anesthesia. I work in Izmir in Turkey in 9 Eylül University Hospital, and I work with the ENT and eye surgeons. And now I'm in ASPA 2022. And yes, I'm in the pain subgroup.
Thanks, Alvin. So I'm hearing that there's manpower there. That's an issue, isn't it?
Yeah, manpower and also source. It's a really big problem too.
Right. Okay. We thank Taniga for her congratulations. Tani, do you want to? I don't mean to sort of give you palpitations, but Tani, do you want to kind of introduce yourself to the community, or would you rather just sort of be? Hi. Maybe a word on like who you are and what you do.
I'm not sure how I look like on the screen, but can you hear me?
Yes, you look great. Don't worry.
Okay. So hi all. So I'm Tanika. I'm a pediatric anesthesiologist from Thailand, and I'm working in a mixed hospital. So we are not a pediatric hospital like KKH. So to my concern, I feel like, oh, so the pain care or the child care will be like much better on pediatric medicine department or pediatric surgery department. But when it comes to the orthopedic surgery or eye surgery or ENT surgery, it is like a mixed unit of adult and pediatric. So I think in that area we can have something to be improved.
Right, right.
But anyway, I really appreciate your efforts and hard working to be certificated to the ChildKind Hospital. Congratulations again.
Thank you.
Thank you. Thank you, Tan. Bonnie, Alan, do you have anything to say in response to this whole mixed hospital issue, which, because I think it's a common problem for lots of people.
Mhm. I can just say that ChildKind was never really intended just to certify big children's hospitals. ChildKind is, we're trying to look at how children are being cared for within hospitals too. So we have hospitals with children's hospitals within a larger hospital, often an adult hospital identity that that are working on ChildKind certification. So it's not just a certification for large pediatric hospitals. What we really look for, though, is are all the principles being met? So is there dedicated resources, staff, to look at pain assessment and management in children, to look at quality improvement initiatives? So that's sometimes where it takes some sorting out to really see what is the children's initiative that we're certifying.
Okay, okay. Thanks very much, Bonnie.
I think there's a budget question. Can I answer
Yes,
that one?
yes. Yes, please do,
Because,
Seren.
okay, with COVID, travel has really gone through the roof in terms of price these days. So, I mean, it's especially with free auditors coming to the country, what I would suggest is we communicated with the CEO that it was a worthwhile project. It was a one-time. We didn't have to continuously renew. We tried to do everything to say to demonstrate that it is a good deal, but it is a good deal. But I think in this day and age, it can be a little tricky because with the budget, the problems that we hit were when you had to do a PCR and then you had to do an ART, then you could be quarantined in a hotel. So if you add that to the airfare, then it just ballooned, the budget just ballooned. So it's possible to do a hybrid, I think, talk to the ChildKind auditors. And the thing is not to say, not to take no for an answer, I think, whatever it takes. So you could possibly maybe fundraise even if if you were so inclined. I don't know, it's just something off the bat that you could consider. Because I think a lot of, yeah.
I put some notes in the chat there about this too. I just wanted to point out that the certification committee and our site visit teams and so forth are all volunteer. So you're not paying for their time. You have to cover the expenses basically. So there is there's a modest fee to start up and a fee for the whole process to cover travel expenses and administration costs and that sort of thing. But I think
it's definitely less expensive than JCI or other.
Yeah, compared with that,
a lot less.
Substantial.
So we also we did push that too.
Yeah, and we're hoping as other regions of the world become engaged, that we will have
a regional center.
Local. We wouldn't necessarily have to send a whole site visit team from North America. Maybe there'd be one person from North America and two people from Singapore or something who would come to Thailand or Malaysia or Japan or wherever, and we broaden the scope of site visits that way and reduce the overall costs. Face-to-face is preferable, as Bonnie's put in the chat there. It's more satisfying. We do get to meet more people and ask more questions and see how things are really working on the ground that way. But the remote one that we did with KK worked remarkably well, I think largely due to Teddy
Yes.
organizing the technology.
Cheers for Teddy.
Did work well, but we would prefer at least to have, at least 1 or 2 people on the ground, even if some members of our visit team came in remotely. We've done that as well, even within North America recently, due to all the COVID restrictions.
All right. Okay. And so I'm going to launch a second poll. It's a really quick one, and it's a yes, no. So we've got people leaving, I guess, because the conference is going on. So just quickly, like a show of hands, how many of you would be? I'm assuming you're here because you're considering certifying your hospital, but I was just wondering if you could put it in the chat box, or if you want to turn on your video and introduce yourself, and maybe kind of say hi to Bonnie and Alan and say, yeah, I'm thinking about it for my hospital. We could, that's where the conversations could start. Yeah. So if anybody who has answered yes, because some of you have, want to turn on your videos, say hello, and sort of touch base now, that would be excellent as well. It's a great opportunity to do so. In the meantime, I am going to show you a little bit about the pediatric pain SIG. So I'm just going to share screen here while you think about that. And in essence, we do have a website. Here's the address, and we can be contacted at aspappsig@gmail.com. Please take a picture of the QR code if you're interested in signing up. Membership benefits do include opportunities to network with pediatric pain experts, both regionally and globally, and with other pain societies. We do have a continuous professional development notice board where the latest webinars, seminars, training opportunities will be at your fingertips. We do have a resource center where we have free educational resources for doctors, nurses, other healthcare workers, patients, and parents, and the opportunity to request for free education sort of workshops and such for members of your team, like the nurses, for example, when it comes to sort of pain education. And we do have a sort of a research forum going, which allows for opportunities for you to create and collaborate with others. The other thing that so this is an example of some of the things that we put out. This was something that we had shared during Pain Awareness Month, which is September every year. And the education team had actually put this out, and it could be shared. It was a PDF file, so it could be shared on WhatsApp, or it could be shared through email to the people on your team, and it could be used just a very quick, simple education tool to bring awareness to others. This is an example of some of the collaborations that we're getting up to. So SPPM is having their first global virtual conference in November. I think it's on the 5th. Yes, so they have quite a few speakers. So Fiona Campbell's up there, Katie Burney's speaking, Jeff Frawley from Melbourne, and then Ross Drake from New Zealand. So they've got a pretty good faculty app. So if you're interested, this is one of the virtual conferences that you will find on our notice board as well. And we will be collaborating with the such. Again, I bring up the ISPP next year. I'm sorry, I don't have Alan's. Alan's a very nice save the date poster, but do remember it is in Halifax, Nova Scotia, and it will be a fantastic conference. So please save the date for that. That's the beginning of October 2023. And this is an invitation for everybody to be a part of something bigger. So do consider joining the pain community in the Asian region. That would be the PPSIG with ASPA. Yes, okay, so I'm going to go back to the poll at this point. And I did see actually that we had a few people who are interested in getting your hospital certified. The information for certification is on the ChildKind website. So if you Google ChildKind International and certification, that actually comes up. So it is 1:41. Sorry, I'm in a different time zone, so I'm a little bit off center and disoriented, but nonetheless, thank you everyone for being here today. I hope you got what you came for. I hope the information that we provided and answered all your questions. And as you can see, we are a very friendly, happy group in general, and all very committed to making Pete's pain, just better overall in the region and globally. So thank you, everybody. Have a good day.
Thank you very
Thanks
much.
for coming, everyone.
Bye-bye.
Bye.